It's now my pleasure to introduce Midge Campbell-Thomas, who is the Senior Vice President of Enterprise Shared Services and the Chief Operating Officer for our presenting sponsor, Bank of America. Welcome, Midge.
Thank you, Eric. Appreciate getting the chance to listen to you and Jessica in that meaningful conversation about our community. Bank of America is very proud to partner with United Way of Ventura County and support today's symposium. It closely aligns with our focus on economic opportunity for communities of color and for other disenfranchised populations. Certainly focused most recently on those who have been disproportionately impacted by the pandemic. In my role as Bank of America president for Santa Barbara and Ventura counties, I get the great honor to act as the local CEO, and am responsible for delivering for our clients, our employees, and our community. We have just under 3,000 employees in the region, and I'm always so proud of the volunteering we do to give back. And last year, it was just over 34,000 hours. And that's a great vision of how we deliver firsthand the importance of the engagement locally, and that it makes a difference to be on the ground and be with our community. To help us continue this conversation today and understand how all of us can make a difference, I get the great pleasure to introduce the moderator for our panel. It's Tony Biasotti. Tony is the executive editor of the Pacific Coast Business Times, our weekly business newspaper that supports Ventura, Santa Barbara, and San Luis Obispo counties. He's covered Ventura County for over 20 years. He's been a staff writer for the Ventura County Star, as well as the Pacific Coast Business Times, an editor for the Business Times, and as a freelancer for those and other publications, including the Washington Post. Tony is a graduate of UC Santa Barbara and a product of its student newspaper, the Daily Nexus. He lives in Midtown Ventura with his wife and 2 daughters and a very spirited Australian cattle dog. It's my great pleasure to hand it over now to Tony.
Hello, thank you very much. The dog is in the room, so hopefully you won't hear her during this presentation, but thank you. All right. Well, I would like to welcome our panel. Do we have everyone? Well, we don't quite have everyone. I see that Mike isn't quite on yet. There we go. All right. Well, anyway, hello, everyone. I'd like to introduce our panel. We have with us today U.S. Representative Julia Brownley, who represents the Ventura County area in Congress. Hello. Thank you for being with us. We have Murtaza Sanwari, Senior Vice President and Area Manager for Kaiser Permanente. Hi. Matt Capritto is with us, a Realtor and housing champion in Ventura County. Amy Duganne, the Director of Homelessness Initiatives at the United Way, and Mike Powers, our County Executive Officer. Again, thank you all for being here. It's a great panel and a large panel. And so with the time we have, it'll only be a couple of questions for everyone. And I apologize in advance for the interrupting I will have to do probably to move things along faster than we would prefer. But I'd like to start with Representative Brownley. Basically, I think you're the best person here to tell us about the federal role in homelessness and homelessness policy, the federal role, the federal approach. And, you know, I'm personally kind of curious because I think for the last maybe 15 years or so, there's been an idea in the policy community that obviously homelessness is not solved, but that like we know what the answer is supposed to be. And it's the, you know, assortment of policies known as housing first. I think that's had some like pretty decent results. I was actually living in coastal California, was somewhat surprised to encounter the fact from the U.S. Interagency Council on Homelessness that the overall number of people experiencing homelessness in the United States is down about 10% since 2010. So what is the federal approach and federal role? And are we are we doing that wrong here? Or do we just have a different set of circumstances that we're not seeing that improvement that the rest of the country perhaps is? I'll turn it over to you.
Well, thanks very much for that. And before I try to answer your question, I do want to just thank United Way and all the sponsors for holding this symposium, and for everyone else who was listening, to every county and city agency for your commitment. Thank you to all the nonprofits who work tirelessly every day to provide housing, both temporary and permanent, meals and showers, and so many other health and mental health services. I think it's fair to say that no one can say Ventura County is not taking homelessness seriously, and I thank you all very, very much. You had mentioned that homelessness has been declining since 2010. My data says it's actually increasing somewhat. So maybe we need to sort of figure that out. But
the answer to that is a recent increase, but
a recent increase. That is true. That is true.
The White House says 9% since 2010. And that was something they said about 3 months ago. So
yeah, I think that's true. And I think Mike can correct me if I'm wrong, but I think the homelessness population here in the county is roughly about 1,700 people, and we weren't able to do a COVID count in 2021 because of COVID, but I would imagine that probably those numbers are still rising. So why are these numbers, increasing? I think it can predominantly be boiled down to two dominant drivers, and that's the cost of housing here in the county, which is very expensive, and the wage disparity in our country, across the country, and certainly here in the county as well, that wages just aren't keeping up, and clearly we need to do more at all levels of government to develop affordable housing and to prevent homelessness. And certainly the federal government must do its part. I will say during COVID, the federal government did step up quite a bit, both with the CARES and the rescue bills. We provided a lot of emergency benefits like the child tax credit, the income tax credits. We boosted unemployment insurance. We provided rental assistance and a temporary eviction moratorium. Between these two bills, there was about $14 billion targeted to people who are homeless. But and it's sad that we actually did these things because of COVID. I think we should be doing more of this under normal circumstances, particularly as it relates to homeless. But I will say right now, I think the biggest opportunity to make real progress on the challenges of homelessness it really sits in the Build Back Better bill that passed the House in November and now sits in the Senate. But this is undoubtedly a transformational bill when it comes to the critical factors that cause homelessness, income disparity, and the lack of affordable housing. Build Back Better further addresses benefits for low-income people, for extending the child tax credit. It was only for a year. It's now expired. We need to get it back and make it permanent. But when we did have the child tax credit, it lifted, half of America's children out of poverty. Build Back Better includes childcare, universal pre-K for 3 and 4-year-olds, paid family leave, lower prescription drugs, expanded ACA to reduce healthcare costs, and a whole lot more that will just provide real relief to a family budget. That will make room for other expenses. So in some sense, the Build Back Better, in terms of these two primary factors, really sort of addresses largely the income disparity or wage disparity that exists in our country. And Build Back Better on the housing side represents really the most historic investment in affordable housing in decades, to the tune of to $150 billion. And I can go through, all of those elements if you would like me to, but I know the issue is that Build Back Better hasn't passed yet, but we will keep fighting. I do believe we will get something passed. It might be a scaled down version from the original version, but even in a scaled down format, it will still be transformational. And I will just say, even under the worst case scenario, there are a lot of bipartisan bills out there that relates to homelessness and housing. There are many House bills and Senate bills that are bipartisan. And in the worst case scenario, we will look at those bills on an individual basis, but I have a lot of optimism because there is a lot of bipartisanship around some of these issues back in Washington. So I'll stop there.
Thank you. I have a really quick follow-up, which is that is the federal government still interested in encouraging, requiring, making funding contingent on the kind of housing first policies that are more common in some communities than others? The idea that yes, services are important, but the most important thing is to put a permanent roof over someone's head, even if they're not getting the other help they need. At least the problems in their life aren't compounded by them sleeping outdoors or, in uncertain situations. Is that, I think that's a decent summary of housing. Is that still a real focus of the federal attention and funding?
Yeah, I think it is. And I think certainly the Build Back Better bill and, the two relief, rescue bills, the CARES and the rescue plan really sort of demonstrate that, it is undoubtedly, there is a shortage of affordable housing. And, back in the 70s when we had enough housing, we didn't have a homelessness issue. So, if we have the housing and we have more livable wages across our country, this, largely, I think, addresses the problem. Some will say, well, it's mental health or it's substance abuse. But I think the issue of homelessness actually, drives a lot of those issues as well. So to answer your question, I would say yes.
All right, thank you. For our next question, I'd like to move over to Murtaza. I have a couple of questions about Kaiser Permanente and kind of you're sort of the representative of the private sector and the healthcare community here. So as a healthcare provider, could you talk a little about the importance of housing for the unsheltered population and the challenges of trying to provide healthcare, some connection to healthcare for that population?
I'd be happy to. Thank you so much, Juan, for inviting Kaiser Permanente and allowing us to share the work that we've been doing and championing within this space. So within Kaiser Permanente, there's a deep-seated belief that being healthy is just not a result of high-quality medical care. You can't deal with medical care unless you actually address the unmet social needs and the community factors that impact an individual's health and well-being. And that includes housing. Housing is a cornerstone to that space. And so we understand that without safe, stable place to live and call home, it's nearly impossible to maintain health and improve health. And we think that the homeless population or the homelessness is a pervasive and urgent social problem that definitely needs to be solved, particularly for the unsheltered. Just as an example, Kaiser Permanente, in our own membership base, within Ventura County, we have 35 people just within our own little population that we have about 75,000, but 35 is still a large number as far as we're concerned, who are our members, but they have no housing. Within the larger Woodland Hills area, it's 82. And so we track this information and we try to connect them to resources along the way. From a major healthcare point of view, we see the human toll. It's astonishing in terms of the differences in the health outcomes and the health inequities for people experiencing homelessness. So a couple of statistics just to share with everyone here. The average life expectancy of a person without stable housing is nearly 30, so 27.3 years less than the average person. And as was mentioned earlier, it's unfathomable to think that in a society like ours, with the wealth that we have, that people have that level of disparity and that limited life expectancy due to simply not being able to afford housing. And the overall mortality rate is 3 to 4 times greater than the general population. And for me, that I just can't even think about that from that standpoint. And somebody that's in healthcare, where somebody's home and the lack of a home contributes to their healthcare needs and their lack of healthcare and well-being. And so the rates of chronic disease, mental illness, substance abuse is so much higher than those who actually have a home. And so the unsheltered homeless population see greater experiences of violence, abuse, trauma, and interaction with law enforcement. And so this is a huge societal problem that needs to be tackled from a multifaceted approach rather than just one area as another. A siloed approach will not solve this problem. It needs to be a systemic solution that really takes into consideration health, takes into consideration social, community, private sector, all of these areas. And so this forum here, and why Kaiser Permanente really looks to support forums such as this, is to create that dialogue, to look for solutions, to identify and bring people together from all aspects of industry and society in order to solve this problem. A couple of additional facts. When we have patients that show up within our own emergency room or in the emergency rooms within the Ventura County area, whether it's the Community Memorial Hospital, which is a partner of Kaiser Permanente out there, Dignity, St. John's, Ventura County Medical Center, the patients that show up really just simply get stabilized for their short-term health needs. We don't end up addressing long-term needs. We stabilize them. It's an episode of care that's addressed. But when they get discharged, the challenge is really there in terms of connecting that patient to any homeless response system that allows them to create safe, stable housing with both supportive services as well as medical respite care. And so that's the challenge, is how do you create this longitudinal approach, connecting them to the entire continuum of resources to allow them to live within a sheltered space and access these services. Today, people have to make choices. And this is where affordability is something that we as an organization pride upon within our own mission. It's a cornerstone of our mission. And we have work to do there to create healthcare much more affordable. But people having to make choices around medicines versus housing versus food is something that needs to be solved, and we are committed to solving. And so part of the unsheltered problem and the permanent supportive housing ecosystem that we're working on, and the work that we've provided grants for within the Ventura County area, is to be able to work with the landlords as well as the populations out there. And it looks like from Ventura County, there's almost 12 to 1,300 unsheltered individuals within that county that we need to address, which doesn't even account for anybody else. I mean, the larger populations that exist within that county. So let me pause there and see if there's any follow-up and or questions.
Yeah, I'm glad you mentioned some of the efforts, at the kind of corporate level, sort of moving from Kaiser as a healthcare provider to Kaiser as a corporate citizen. Tell me a little more about the landlord engagement program specifically, and any other support for United to End Homelessness, and kind of what is about that program that you think is worthy of Kaiser's support.
Yeah, so it was a couple of years ago, in 2019, Kaiser Permanente as an organization nationally invested nearly $200 million, made a commitment to invest $200 million within the housing and homelessness space to look at both addressing the unsheltered, looking at social needs associated with that, but then also looking at ways to create affordable housing partnerships where we give loans at a significantly lower cost of return to private sector organizations partnering with venture capital to be able to create housing opportunities. As far as what's going on within the Ventura County space, the $75,000 grant that we gave for the landlord engagement program was specifically around that. And so when we look at creating anchor institutions, we can use our resources and our influence to lead and catalyze change through both impact investments and our advocacy and our thought leadership, being such a large organization that we are. And so as a community partner, one of the things that we decided to do was the United to End Homelessness initiatives and provide a grant for the landlord engagement program, because we think these efforts will help catalyze change specifically within the Ventura County. And so we support that work. We believe that it's important to align private funding with private sector dollars to more efficiently support services and solutions needed to reduce homelessness. A couple of other areas and the goals that we're really trying to achieve through the larger Housing for Health initiative within the organization is, one, to transform care by improving coordination among the continuum of care elements. So social services, as I mentioned, housing providers, improving access to quality medical care for anyone experiencing homelessness. Strengthening the homeless response system is really establishing system-level approaches that drive population-level goals. Preventing homelessness by expanding evidence-based housing, stabilization assistance, and then ultimately increasing housing affordable supply. And that's critical. And we've seen this in so many different places, just to create affordable housing that's truly affordable, but not masked by something else. And so that landlord engagement program is a very important step, we believe, to increase affordable housing within the Ventura County. And we look to continuously partner and further engage with both city, county, state leaders, and the private sector to be able to create opportunities to increase the number of affordable housing units within the county.
Well, I want to thank you for that fantastic segue, because I want to talk more about the landlord engagement program. And my next question is for Matt. In addition to your work in real estate, you are also an owner of rental housing in the community, right?
Yes, sir.
Great. So yeah, tell us about the landlord engagement program from the landlord point of view. Just a kind of quick overview of how it works and how well it works for you.
Thank you. Thank you. I wrote down something our author, Jessica Bruder, said, and it's meeting people where they are. And I think that's really the essence of the landlord engagement program. It's pretty unique because this program takes the direct route of engagement in securing landlords. It also provides bonuses and incentives for landlords. I think the essence of the program, the secret sauce of it, really is the dedicated housing specialists. They are there to answer questions, to offer support. It really is the backbone, and I think the success of this program, because it's a hands-on process. It's hands-on from the standpoint of those looking for a home and coordinating with landlords.
Yeah, walk me through a little, of how this program actually works and what it provides to the tenants and to you as a landlord. Like, if people are completely unfamiliar with the landlord engagement program that we've now mentioned a few times.
Yeah, well, I think right off the top, it is I may be called by a housing specialist, and as a landlord, I may not be familiar with the voucher program. The voucher program itself is underutilized. It's not well known. I think that there's some inherent discrimination within the program only because of lack of knowledge base. I think it's a program that really could use much more support. And I think the proof of it is 150 people have been housed as a result of utilization of the landlord engagement program, utilizing vouchers. To continue, there is assistance with the required inspections. And I think probably the overall benefit for an owner is it's this assurance of prompt, consistent rent. For this particular population, let's just talk about rentals in general. If any of us were to go out and look for a rental, securing a home is a very difficult process. I could get 100 calls on a rental if I put something in tomorrow, easily in the next couple of days. For those with the unique challenges, anyone who's homeless, a product of domestic abuse, anything else on their plate, I think the process is, the challenges there are completely overwhelming. So I think the essence is having a dedicated housing specialist to actually help and walk someone through that process has been really the success of the program. Oh, I'm not hearing you.
Thank you.
That was good. You had me going there for a minute.
I myself like I was supposed to. We'll get back to the landlord engagement program a little more from United Way's point of view with Amy, but I just wanted to ask you first, in a more general sense, if there's anything else that you have in mind that that landlords can do, that people in the real estate community can do to help end homelessness.
Oh, I think that's I guess that's probably there's a two-part answer to that. If I had my wish on a more grand scale, we would increase access to the voucher program. That's my wish. Okay. But I think as much as that could happen, the program really needs more landlords. In Ventura County, the majority of homes, of properties out there are owned by individuals, the mom and pop landlords like myself that could really help in this process. And I really believe that with a little more of a dig, we could put this program together with more individuals and really do some substantial work in putting those that are unhoused into housing.
Okay. I want to go to Amy then and ask you. Hello, Amy. From the United Way's point of view, what are the obstacles to scaling that program bigger? Whether it's funding or anything else. But tell me what the landlord engagement program, if it's a scalable model, and if so, what can be done to make it bigger and better?
Thank you so much. And thank you to everyone on the panel this morning. So it all boils down to the partnerships that we have in our system right now. The landlord engagement program was born from a public-private collaboration, funding and ideas around this landlord engagement concept, and leveraging that to increase our impact and our success with our unhoused community. We, as Matt has said, need more landlords, of course, to increase the number of vacancies available for those households with housing vouchers. These partnerships we have with landlords are critical. We're providing outreach, we're vetting vacancies and securing them, we're facilitating these tenancies, bringing these vacancies to our system. The program is serving as a liaison, as Matt said, to help educate and help our landlords navigate our housing and homeless system. We're also partnering with our housing and homeless service providers. And we, again, share these vacancies with the system, connect these landlords and these tenants, and assist with that housing navigation. And we're partnering with our local public housing authorities. They issue the vouchers attached to these households and are a critical partner in this process. Because of these collaborations, as Matt said, we have been able to be a part of housing 150 individuals. This includes 49 children, 39 seniors, 39 veterans. these numbers matter and they're important. But what I want to hopefully impress upon everyone listening who's already pretty familiar with the landscape is that these numbers represent people from all backgrounds. And these households have been forced to make really serious compromises about how they're living just to survive. They've faced life events that have proved financially fatal, divorce, illness, job loss, death in a family. And this is deepening our class divide, and also exacerbating that are our rising rents and the widening wage gap that we're experiencing, that has been touched on both by Jessica and everyone on this panel. So it's really not hyperbolic to say that anyone can face an economic crisis that leads to subsequent homelessness. And it's really, as Murtaza said, multifaceted. We need to take an approach that handles needs from all levels. And it's, we ask ourselves, what do we need to do as a community in addition to securing more landlords and more landlord engagement? The United Way's mission is to mobilize and inspire the caring power and the resources in our community. We're seeing that, and it's wonderful. This means we're engaging landlords, we're engaging our community, we're advocating, we're raising awareness. Very, very importantly, we're working to dispel some of the myths and destigmatize what it means to be unhoused. We're trying to change the narrative. We need to educate. We need to learn. There is a real moral urgency to what we're doing, and we can't underscore that enough. Urgency and the humanity in this. And housing is a human right, and that means we are valuing people, and we need to have this shared ethos among us in doing that. I think it's important to realize we see that by representing our private sector, our healthcare system, our public sector, our government, our landlords, that we are all stakeholders in this, and it's a community investment. We cannot afford to underinvest in what we're doing. And in sharing this collective goal of trying to prevent and end homelessness, I want to emphasize some things that we are doing and that we can be doing. We can raise the scale of the economic and housing crisis that we're facing, and think about how our neighbors on the margin are really at the center of the consequences of these crises, and we need to reverse that. Again, we need to dispel myths and continue to destigmatize what it means to be unhoused, and that messaging is very important. Someone is homeless as a result of a lack of affordable and available housing. It's also, of course, because of our income disparities and wage gaps and that inequality. We need to try, we can move away from zero-sum thinking, that this bias that in order for someone to gain, someone else needs to be disadvantaged or suffer some loss, and realize that preventing and ending homelessness really benefits our entire community, us as a society, as humans. And very importantly, and I'm eager for Mike to be able to share what our county is doing. We really need to help create a continuum of housing. One size does not fit all, and we need more supply. We need more housing options that are immediate immediacy, again, is so critical, and also some long-term solutions. We need to, I'm hoping we can ignite more empathy among us, because public policy is impacted by public, and we need an informed and caring public to do so. And I am grateful that we've shown during this global health crisis what can be done with some urgency. We've had greater resources than ever before, and we've been able to leverage that. And strides have been made, and we can do more. We can do a lot more. So thank you.
Yeah, thank you. I have a question specifically kind of about the landlord engagement program, but in your wider work in general. So Ventura County, let's see, where is it? Ventura County's apartment vacancy rate has been under 2% in recent months, much lower actually in some instances. That's crazy low. It's, extremely tight rental market. Double that would still be pretty low. Just hypothetically, like, how much easier would it be to place people and to do your work if there were, 3 times as many vacant apartments at any given time in the county?
It would, of course, be much easier. And we can't develop it fast enough. So although there are some wonderful developments in the pipeline, we're still years away from being able to enjoy and appreciate and bring that to our system. So we need to look, and therein lies where we need to look, to existing landlords, existing rentals. And that's all we have to go on right now. So we need more units for sure.
Is that the big constraint? So you mentioned, 150 households that you've helped find homes. Not to put everything in the world on solving this problem on the United Way, but let's say, we wanted to house 1,500 instead of 150 people through this program. Is that achievable? And what are the obstacles? Or do we need to, look again, like I said, to someone other than United Way to pick up some of that?
And let me just correct one thing. 150 individuals, that has been 88 households. So not even as grand as 150 households. So we do not have the housing stock to address a number like you've just mentioned. I believe some housing innovation would certainly increase what we're able to do immediately. Again, developments are taking a bit of time, but we have to be creative about unused parcels of land, tiny homes, shipping container housing that can be erected at a more rapid pace. Although I know COVID has exacerbated a lot of our construction challenges and things around that nature. But if we could bring 1,500 housing units to this community, oh yes, we would end. For all intents and purposes, we would be able to end homelessness. But we need them today. We needed them yesterday. So that's a huge part of the challenge.
Actually, had a question for you along those lines. Do you think, so we are seeing some development of new housing, at least I live in Ventura. I see a lot more in construction now than I have at any time in the past, since before the housing crisis or the crash in 2007-8. What role do you think specifically market rate housing development plays here? I know the theory, and it kind of makes intuitive sense, is that even if you build a new building with a bunch of $3,000 a month apartments, that's still increasing the overall housing supply. It's taking other units that aren't as new and nice and moving them kind of down the chain of desirability. And therefore, people who might be on the verge of homelessness or in need of cheaper housing will have more to choose from in their price range too. Is that something that you think will have any effect, or are those, two separate problems, the lack of higher end housing and the lack of housing that might help homeless people, are two separate markets, or do you think there's any relationship there?
I think there's definitely a relationship, because as you've just touched on, it creates movement. And without that movement, everything is stagnant, obviously, and there can't be those who are very low income even moving into units. So we certainly need that, but we need to do, I think, continue. There are many groups working around these issues, but as we see market rate development, incorporating low income elements into those developments, having those set asides are critical. Would love to see more of that. And there are ways that jurisdictions can incentivize developers to do more of that. So again, we need both to create movement.
Thanks. I want to move over to Mike Powers for a minute. And before I get to a more general opportunity for him to talk about the county's role, I want to move off of that. And since we're talking about housing development in general and market rate housing, the 30 seconds of research I did before this started for something along these lines, I encountered an academic study that I guess Zillow was, putting out. The paper was publicizing it, but it was an independent academic study that found basically where you get above 32% of income toward rent in a community, that's when homelessness starts to rise really rapidly. And it does that independent of what services you're offering for the homeless, what amount of, highly subsidized low income housing you're providing. But basically just the cities and states that have the most homelessness are the ones with the most expensive rental housing and the least, the lowest vacancy rates and the biggest supply constraints. So, that's not the whole problem, but it's part of it, I suppose. Mike, and again, this isn't just all on the county. Obviously, there's local governments at every level involved in permitting new housing. And in Ventura County, it's more the cities than the county. But from the county's point of view, what can be done to increase the general supply of housing? And do you think that that's something that'll have an effect on homelessness?
Well, of course, yes. Good morning, Tony. Panel members, community members, and partners. So yeah, really important question. One of the things our board of supervisors just did is approved about 234 units of affordable and supported housing, along with our community partners like our area housing authority, many mansions, people self-help. So that's the kind of thing that can really help. It goes directly to the issue. Permanent supportive housing solutions are critical. We've seen that done with home key projects. One just approved in Oxnard that's already up and going. Another one that the city of Thousand Oaks just approved. 77 permanent supportive housing units. So, and then as you mentioned, Tony, cities are building more than they have. All levels of housing are needed. So that's really important. So yeah, it gets down to it. So the studies say that to really solve it, you need about 4.5 housing units per unhoused person. And in Ventura, we have 1-1 in Ventura County. So that frames the issue, but we know what the problem is. And so it's these kind of projects that are really going to make a difference.
The actual supply of housing is, like I said, I don't think the county isn't necessarily the primary mover. Most of that development happens within the various cities. But as far as social services, I think the county does take a lead role, at least locally speaking, in a lot of that. So give us an overview of what the county of Ventura does. I know there's a lot, but what the county of Ventura does to help people who are experiencing homelessness and to try to help them not be homeless anymore.
Yeah, thank you. So a couple things. First of all, I appreciate United Way convening this discussion. As Amy mentioned, it's an urgent time. It couldn't be a better time to have this discussion. In terms of the number that was referenced earlier that's gone up before the pandemic, I think a good part of the reason for that too was that the quality of the count improved. Technology, it was a broader scope count, so we're getting a better sense of the numbers that are out there. I want to appreciate Congresswoman Brownley because the funding sources we're getting from the state, the federal government, housing vouchers, so critical. CARES, ARPA funding, but also FEMA funding has been really critical. So I'll touch on that more in a moment. But just stepping back for a minute, yes, the problem's gotten worse in some ways. On the other hand, our systems are working better than ever. Our partners, county, city, community organizations like United Way are working in a more coordinated way than I think I've ever seen in the 20 years I've been connected with this with these issues. So let's get down to it, what's happening at the county. So pre-pandemic, our board put up a matching opportunity for cities to build permanent year-round shelters that are low barrier shelters, housing first model. And so we've partnered with startup costs and ongoing operating costs with the city of Ventura, Oxnard, and Santa Paula, and that offer remains out there. So that's made a big difference through the pandemic. And this number might surprise people. Over 1,700 people have been placed in positive housing placement. So that's really important. And I want to talk about Project Room Key for a minute as well. And that's really been funded by FEMA, and that's been so critical because the county was able to place over 700 people in this program. And when the governor said at the outset of the pandemic, you need to house your medically fragile homeless people, at first that sounds really daunting, right? And it was. But because we have this program called Whole Person Care that really reaches out to high utilizers of healthcare, we knew who they were. And we were able to place them right away in hotels so that we were able to secure with our board's funding. And so they say never waste a crisis, right? And so because we had folks now placed in some level of housing, we wrapped around services, and a lot of those folks, I want to say almost 70% of those 700 folks have been placed in some level of housing. So there's a whole lot more to do. It's a huge problem, and that's for sure. And what we're talking about today is really important to help address it. But I do want to talk about those systems that are working and where we're seeing results. You mentioned, Tony, social services. I think it's really important for the community to know just how much community-based services are being provided. So we'll start with like street outreach. Like we have a backpack medicine program. That's physicians, going into the river bottoms, wherever you need. But also that encompasses a multitude of programs. There's primary care physicians, public health nurses, mental health counselors, alcohol and drug counselors, human services agency, homeless placement counselors that go out into the community, into the riverbeds, wherever they need to go, basically bringing the door of our programs out into the community where they're needed most. And it's making a huge difference. Whole person care I really want to highlight that just for a moment. This is a pilot project that's worked so well in our county and others that the state is really going to expand healthcare in this way. And what that does is it takes people who are high utilizers of healthcare, and I thought I knew what a high utilizer was, but this is like sometimes going to the ER every other day, or in some cases every day, right? But now because of case management, but also community health workers who are connected to these folks who make sure they get to the doctor, they get their test that's ordered, they get and take their medication, really that last link in the chain, making sure that care is provided. And there's about 1,500 people in this program. We've seen dramatic results, 2/3 reduction in emergency room visits, and tremendous improvements in their overall health outcomes. So those groups, whole person care, is also out in the field, building those connections. And that's really important too, because many folks adapt, as we heard from the author before. Every person's different, and once they become homeless, they go into a spiral, right? And they adapt. That's great, but there's still trauma connected to it, right? And they're making the best of it, but it's not the best situation for them. And so sometimes they're resistant to placements or services. What these folks do who go out in the community, these health and social service providers, they're so skilled and they're so empathetic. They build trust, and they say, okay, well, we're providing your help, but we could provide better support to you if you were housed. Would you be open to a housing placement? And that's the kind of thing that people might not see, but it's incredible trust and skill that they build with these individuals, because each individual is different, right? Everybody's experienced a different level of trauma and challenge. And so it's a really personal way of doing it. On a coordinated standpoint, this continuum of care that we have is really working so well. So what is this? It's a board that was created partly because we needed to for HUD, but we've made it more than that. It's got the county, 4 cities, area housing authorities, community organizations, and a person with lived experience. And so much of the state funding now comes through this organization where we all say, let's partner together. And what's great is 20 years ago, if you'd asked, where should we put homeless funding? I say, put it anywhere, it'll help. Now we know, no, here's what we have, And here's where the gaps are, like permanent supportive housing. So we can really target these funds to the greatest extent possible. And the coordination, the collaboration is happening. Anyone who's homeless goes through a coordinated entry, a single point, so they get the right level of housing. There's a common information system, HMIS it's called, where everybody's on the same system so they can coordinate care better. And we have an MOU with almost all the cities in the county that we're going to coordinate and everybody participate in these systems so we can coordinate, collaborate, and have better placements. And homeless prevention rapid rehousing is one of those super effective programs too. So what is that? That's basically rental assistance for 6 months or so. But it has an amazing result. We've got like about 1,500 people on that in our county right now. We talk about prevention and what the author talked about earlier, how important that is, because once they become homeless, a spiral happens. And if we can prevent that, it's such a better outcome for them personally, but for all our systems, right? And for our community. So that's working very effectively. And then last point too is our board has approved, and our hospital, along with private systems too, some recuperative care for unhoused individuals who are discharged from the hospital, but not ready to be out on their own yet. So that's a lot. I know we also have 8 homeless one-stop locations throughout the county, where 1 day a week at a certain time we bring all of these resources out, and we also have shower pods and so forth, just to help people with their dignity and so forth. So a whole lot more to do, but there's an awful lot going on, and I think there's a lot of momentum built in the system if we can continue to focus our resources in the right way.
Thank you. Excuse me. I have a question here from the audience that I want to open up to everyone, which is that California has mandated cities to add affordable housing and been given targets to reach. And those targets have a lot more teeth, with some recent state legislation than they used to. How can affordable housing advocates fight the resistance by local cities to honor the mandate to meet that demand? This question assumes that there is resistance, but I don't think that's a terrible assumption. So I thought of that as a question for Mike, but I think this touches on everyone. So if anyone has any input on that.
Well, understandable question, and local control, we understand, is important to our cities and our communities. But these are members of our community, and these programs are very well operated and safe. And sometimes there's more of a fear of the unknown, understandable. But when you really get down to it, we're treating people with respect, with respectful placements in nice facilities with experienced operators who know how to protect the safety of the people they're serving and the community in which they're serving. So I think some of it's just overcoming those barriers of the unknown. And we're seeing success on that already here in Ventura County with some of the projects I mentioned earlier.
I have a related question again for the whole panel. My experience as like a local news reporter, I'd always had the assumption, doing this for 20 plus years, that any new housing development is going to have some level of community opposition, like significant enough to get people to come to the city council and be angry. And the lower income it's geared toward, basically, the more that's going to happen. Have you noticed any change in that? Is that still the rule in Ventura County, or is there a shift in public opinion, you think, these last few years toward, just a more generally pro-housing or pro-development view, specifically toward affordable housing or more in general? Am I imagining that change in public opinion, or is that something that you're noticing?
I'll speak to that a little bit, at least from my observation, and I would not try to presume that I am all knowing it all in this, but and I also think that our virtual world has changed some of the opposition, perhaps because people have not been able to flock to meetings in the same way as they may have in the past, but I think the NIMBYism and opposition is still apparent, but I am encouraged because I do see I do see a community that is starting to become more aware of the disparity of, COVID has really exacerbated those suffering the most. And I think that there is a softening perhaps that is happening among some in terms of development, and just realizing that survival depends upon it, and seeing the impacts of those who can't afford to live here, and then the workforce that is impacted, as well as those who are already unhoused.
I would add, and I've seen in other communities where the more you build affordable housing that blends into market rate housing, the more acceptable this issue becomes, because the community can see how it can coexist. And so I think, what the state is doing in terms of mandating is a good thing. The federal government typically leaves this up to the states and cities, and don't get involved in, building codes and other kinds of local regulations. But I do see that when that affordable housing is blended into market rate housing, it helps considerably.
I'll speak to this a little bit. My business is real estate, and I think I'll take a little different tact here, in that I think there are really a number of people who believe that there's enough here. Let's pull up the wall and not build any more at all. And I see that, I hear that. I don't know that that's, and I mean housing on any level. It's disturbing to me, because I don't think we can be economically viable without that. That's setting aside the component of affordable housing, because what really is that? With many affordable housing projects, they have term limitations on them and restrictions on them. Look, I see a disturbing trend that sometimes points the other direction. Not to be the naysayer here, that we have enough, why build any more? And there's a zillion reasons for it. Not enough water, not enough infrastructure. The need is there. The question is, how do we convince our community members that we really need to have housing to have ongoing sustainable growth in our communities? Some form of housing. Thank you.
This is Murtaza. If I could add a little bit here, there's probably so many layers to this, and one of those layers has to do with, when you even build affordable housing, just the cost of construction. And I'm not in real estate, but the cost of construction, all of the various requirements associated with what housing needs to look like, the materials, but then also the regulations and the codes, significantly turn what may be affordable into something that's not, because the owner then has to charge significantly higher rents. So there's an element to that I've heard in sitting on even the Warner Center board that sits here within the Valley area. The other part of this is getting people to destigmatize who the individual, as Amy mentioned earlier, around the humanity of what's happening and who is actually homeless or unsheltered. And so one of the projects that we've actually taken on is we funded a film project, which is called The Way Home. And so this project is available on Amazon Prime for people to watch, but it really is a short form documentary that starts to address the human side of what this crisis really is, and humanizes the individuals, so that people don't create these maps in their minds about who is homeless, and are they criminals, are they drug addicts, versus there are so many who are just families that just cannot afford housing, and they're out there. And so it's intended to create a deeper understanding of the problem. It's intended to spark conversations about with your neighbors and individuals about who is homeless. And then ultimately it gets into what are the causes of it and the solutions that are potentially out there. And so that's another way to really start to change the narrative that was earlier described around the homelessness crisis, so that people then start to engage at a much larger level, because we can do all of these things, but if the community continues to object, then it doesn't allow those projects to materialize. So I think it's a very interdisciplinary approach to addressing it.
And looking at the different approaches, the tiny homes that were mentioned, ADUs, every level, but also hotel conversion. Building from scratch is hugely expensive. But we have once in a generation funding available through the state and the federal government, like Project Homekey, these hotel conversions. They're still expensive, but it's a whole lot less than building from scratch. Or just looking at every level, all these different solutions, packaging them together.
The hotel conversions is interesting. I think that over many years, multi-generational trend has been that we don't have that type of housing. If it does exist, there's a stigma that's like basically a flop house would be but that in previous generations, there was more very cheap housing, even if it was market rate. It's not anyone's first choice necessarily to live in like a boarding house or a residential hotel, but it's far, far preferable to homelessness. Is Project Room Key and Project Home Key, are we seeing some new interest in that kind of model that might be a higher quality product than the traditional residential hotel? Is that something we'll see more of?
Yeah, and I think that is what's happening, Tony, with as I say, Casa Aliento in Oxnard, that hotel conversion, and the hotel conversion just approved by the city council in Thousand Oaks. They're investing significant dollars, and how much can a building say? Well, it can say a lot, because the quality of that building says a lot about the people that were housing there, their dignity and respect, and the community surrounding them. So they're investing significant dollars to make these really quality facilities, and also a lot of wraparound services. Some of these folks too, like people who need permanent supportive housing, they're going to probably need it for their whole lives, and if they didn't have it, they would end up homeless.
I would just say too, as we adjust to a new normal, living with COVID, I guess is the best way to describe it. And I think more people are going to be working from home. There are going to be office buildings and other things that are vacated that I think we need to start thinking about in terms of how we can convert. Going back to what Mike said, how we can convert existing facilities into housing for our homeless.
Thanks. Our hour is nearly up. I see another audience question that I didn't get to. We kind of touched on this before, but someone said that they noticed there are many new builds going on. They seem to be geared toward higher income tenants. Why is this happening? And are these complexes part of affordable housing mandates, which I take to mean, do these have to have some affordable component? I don't know that, the ideal person I would ask here is like a city manager for where these things are going on. I don't know that we have that on our panel, but if anyone has any insight into that question, take it away.
I think the thing I could add is that many of the projects, it takes so long to get a project off the ground that many of these were started so many years ago. It's just kind of by chance that we're seeing them all come together at the same time. I think that's probably more of a reality than anything.
I would say that with the housing elements for the cities and the county, the regional housing needs, we've always had that, but the state has really increased the motivation, I will say, for cities to comply with that. So, and some of it's just the need. They're seeing the need and they're building, but definitely there's a stepped up increase energy from the state on the housing requirements.
My best stab at an answer on the affordable mandates part would be that, I don't know about the specifics of each city and each individual project, but generally you got to do something. Maybe it's you have to set aside part of your specific project on site with subsidized affordable units. Maybe it's you have to fund an entirely separate affordable project somewhere else, or maybe you're just paying into a fund that the city then uses for its own affordable housing programs. But in most cities I've encountered, you have to do something. But the sort of inclusionary zoning is the term in
Exactly.
urban planning, the sort of inclusionary zoning where you're telling every single developer, oh, you're building 20 new units, 2 of them have to be low income on that site, is not universal. There's some cities that have moved away from that model just because it's hard to get people to do that. It will, make the developer entirely uninterested in the site, and you'll get zero housing. But
Or they try to incentivize.
you have to do something. Yeah. Okay, well, we have reached the end of our hour, so I want to thank everyone very much for your help. This has been really enlightening for me, and I hope for everyone else. And I know that we have a session with Assemblymember Irwin now. So I will shut up now, and I don't know exactly who's taking over for me. Any further questions, I think, can come during her part of the session. Thank you.
All right. Thank you so much, Tony. And I'm actually taking over for you. And we're going to be continuing the community conversation. So first, I want to say thank you to United Way and all the advocates that are actually listening to this session, and the people that have done such good work. The county really is a model, and what United Way is doing, Amy especially, has been fantastic. It happens that I am dealing right now with redistricting, and I've gone from representing just Ventura County and a little bit of LA to representing the West Side. I've had a lot of conversations in that area already, and then also we looked at the PPIC report, and housing costs and homelessness are the #1 issue for everybody. And unfortunately, the numbers are so high. It's not just coming out of a position of compassion, but you're starting to really see people that are getting angry about the situation, which really exacerbates our problems. Although with the pandemic, we have seen the number of homeless rise. I think what Mike said is really accurate. There is an incredible opportunity right now with the unprecedented amount of federal and state assistance to find models that work. And I want to say clearly, and I think we've alluded to that already today, that just throwing money at the problem it will not solve it. The solutions have to be well thought out, and they have to be cost effective. We have to be able to replicate them. We've seen really promising programs, I think, in Ventura County. Mike was talking about the whole person care. I think that is really critical. The landlord outreach program, very inexpensive way to get people into housing, and the hotel conversions, I think, show some promises too. I did not hear it mentioned that when we build low-income housing from scratch, I think right now we're almost up to $500,000 per unit. And that is pretty extraordinary, and probably not something that we can continue to really put a big dent in the issue. It was mentioned a number of times. I think some of the impediments we're looking at is community acceptance of low-income housing. I haven't heard much discussion on guardianship. That is a real big question for people that just don't want to get off the street and not really capable of making their own decisions. And then also making sure that people on the street, many of whom have mental health problems, that they have access to mental health services and easy access to antipsychotics if that's what the physicians prescribe. Before we get to the questions, I want to talk about one other thing, the VHHP bond. There's been 2 rounds. That's something that I'm carrying right now. There's been 2 rounds of that funding that the voters have approved. And that is, if you look at the past decade before the pandemic, the one part of the homeless population that really has seen significant improvement is our homeless vets. And I really attribute it partially to this VHHP program, which is providing housing with wraparound services. And we're going to try to get it. The money is almost depleted. We're going to try to get that on the ballot again, or at least get funding, because that has been very successful and hopefully a model for how we get other populations off the street and into housing. And so with the three of you that are left, I guess we've covered a lot of it, but let's start with what do you think the most meaningful action is that a county like Ventura County, where we have high cost and low vacancy, can take to prevent and end homeless? You've talked about a lot of different things we can do, but what would we really pinpoint as the most meaningful action? To any three of, why don't we start with Mike?
Okay, thank you. Thank you, Assemblymember Irwin, and thank you for your support for a lot of these resources that we're able to get right here in Ventura County to address these problems. Two things I want to mention. One, we talked about housing before, increasing affordable housing, permanent supportive housing, wraparound services, absolutely critical, but also like farm worker housing, particularly on the unincorporated area. I think that's critical, and our board just approved the largest such program project I think I've in our history at 360 units just outside in Somas. So that's absolutely critical. And so just at all levels, more affordable housing, that's number one. But continuing to coordinate in a partnership way, I think is so important. And we're doing that really well with our city partners and our community organizations. One example I'll give you, the Santa Clara River bed 5-6 months ago, there was anywhere between 60 and 100 folks living down there. Very dangerous for them to be there, particularly with rains coming and so forth, and not the right place for them to be. But we partnered with law enforcement, sheriff, police, the cities, fire, community organizations, and our healthcare and homeless services folks to say, well, we could clear it out in just a couple of days, but then they're just going to go back out on the street in the cities. That's not a solution. That's just shifting the problem from one place to another, for the whack-a-mole model. So we said, no, wait, let's take the time to engage with these folks with our street outreach, our health and social workers, build that trust, and then work to try to get them a placement, most of them in Project Roomkey, work with them there so that we can then place them in more permanent housing going forward. And that did happen. And those folks got placement. Most of the placement stuck, not all of them did. That's just the reality of the situation. There's no easy solutions. But it was that collaboration where it wasn't finger pointing. It was, hey, this is a collective problem of our cities and counties and community. And I think it really made a difference. And it also helped certainly when the rains came and they weren't in there. And so it's just an example of, I think, the kind of thing where by continuing to share the load here collectively, it's going to make a difference.
Okay, and Amy, you've dealt a lot with veterans, and specifically veterans who come with money from the federal government to help with wraparound services. I had gone to a seminar in Orange County where they said their goal was to get to zero functional veteran homelessness. Mike said he was going to take that challenge on. What do you think it takes to actually get all our veterans off the street?
Well, it is not an insurmountable task. Our numbers are low enough that we should be able to take on that challenge and succeed. It's going to take the units. We need the immediate housing units. So that brings us again to more landlords providing that key, opening up their units to all our populations, but our veteran population, we have the majority who are attached to our VASH vouchers. So there is that housing subsidy, and then also some who don't qualify for that, but veterans who need those units as well. And in addition to a plea to our current rental market and landlords, more housing innovation of what we can do with immediacy. So back to the motel conversions, and some other creative options that still provide a permanent solution, that aren't temporary.
Yeah, oh, sorry.
Go ahead.
I was going to say, yes, Assemblymember Irwin, I know we've talked about this many times. I know how passionate you are about it, as is our county. And so when we were talking a couple of years ago, the number was roughly about 100. So, and we just thought, how can we not find housing for our brave veterans who sacrificed for us? As Amy said, it's a manageable number. And so there has been progress. I understand there's about 45 who were in shelter, another 21 who have been permanently housed in the year 2021. There's about 13 who are not connected. So we're not there yet, but a lot of progress has been made with the coordination of the systems I mentioned with United Way and Amy's program. That's made a big difference. Gold Coast Veterans Foundation is making a big difference as well. So this is the best part of Ventura County, when these groups come together just to help people, one at a time. And that's what it takes.
Matt, just you talked a little bit about getting community support for low income. We just lost my getting support for low income housing. I have seen a big difference in the communities, that more people are seeing that we need to that we need to really address this issue. But there are still many in our cities that are going to city council meetings, and it's a lot of pressure on city council members that they don't want additional housing, that they've had enough. And those are the things you mentioned. What can we do to get more grassroots support, as opposed to just the organizations that are working on it?
What can we do to get more grassroots support?
Yes.
I think there's a certain amount of fear of the unknown, right? Especially when in the overall adding of housing to any community. I think that it's a great question. I really think it's incumbent on all of us to look at the reality within our community of and the overall need. We can't continue to be sustainable in our communities without additional housing. We really need affordable housing. I don't have a great answer for you. Obviously.
Yeah. No, I think it's something that we're just all grappling with. And I know, as somebody that's sat at a city council, when you have on a city council, when you have 100 people coming and speaking in opposition of a project, it's very difficult when there are few people that are neighbors that are saying, yes, I'm willing to take this on. So it's kind of that paradigm that we have to take care of our community by allowing additional housing where it's appropriate.
I think that's really the essence of it. How do we take care of our community? And I think it's really not really about me, Matt. It's about how can we make our communities better. And I think when we look at it from that standpoint, we will end up with better communities. And I think that speaks to those that are landlords that are not engaged yet. I think there's a need out there, and I think there are those landlords out there that are compassionate with a heart, and this is all in making our communities a better place to live. So when it comes to that landlord engagement part, there are landlords out there that will hopefully hear this message and step up and really do their part and help solve this problem, because I wish it were a county problem, a city problem, somebody else's problem. But I think the issue is it's all of us. And I think to reiterate what Mike said, we're all in this together. And I think we really have to do a better job, continue working together. But I think there's more to be done. So thank you.
Well, thank you, Matt.
Thank you for everybody. I know Mike has something to say, but I first want to remind the audience that if you have questions for the panel, please put them in the chat box. And Mike, did you have something to add there?
Thank you, Assemblymember. Just to follow on what Matt said, I think we know we live in a very compassionate, generous community, and with all the disasters we've had, we've seen it demonstrated time and again. So I think it's a matter of really describing these personal situations, that people deal with. That so many people in our community, they're one bad accident, one severe illness, one divorce, one lost job away from being in a similar circumstance. Some of these folks who are homeless or in the riverbed, they have jobs. They just can't, and they're trying to live a normal life, but they can't afford to find a place to live. And so really thinking about it from their perspective, I think does humanize it and makes it more practical. And then destigmatizing, as I said before, I think there's understandable concern that what this might mean, but it just really showing more examples of where supportive housing and other housing programs are in communities. They're very safe and well run.
I have please, Amy.
No, just to build on that with one comment, really, helping to change that narrative as everyone is discussing here and sharing those stories. I think just to add to that, a critical component is adding those with lived experience, which I've recently learned on a call is now better called lived expertise, and bringing those with lived expertise to the table and including them both in decision making, but also providing an opportunity for those with that lived expertise to share their stories.
And to your point, Amy, we've had that expertise on our continuum of care from the get-go, and it's just a difference maker. It's a game changer.
Agreed.
Best perspective of all.
Okay, I have a question from the audience here. Do you get resistance among those paying market rate for the same apartments or housing as others? So this is when you have, assume units set aside for lower income folks.
I mean, as a housing provider, there is no difference. There should be no difference. I'm in the business of providing housing, and I think it's incumbent that I come to it with, does this person meet the need? And if they do, then there just should not be, no one else should know. Does that make sense?
Yeah, that
should not be an issue. That's in the I guess that's a nice way to say that's the reality. Does that happen all the time? No. There are individuals with challenges, and we still need to meet the need. And they still should be integrated within our community. And we all need to do a better job of accepting individuals. I think that's part of that compassionate part that we all have inside of us, that is certainly as part of the landlord engagement program, the success of that program.
So and I'm not sure exactly what the question was. I assume that if you have an inclusionary housing policy, let's say for sale units, and a certain number of them have been set aside, has anybody had experience that, I understand that you're saying nobody should even know who it is, but has anybody had experience where people that are paying market rate think it's unfair that, or have problems with certain people in their development not paying the same amount? Have we seen anything like that? But probably you three are not the ones that might have experienced it. It's probably more the developers or the city councils, but I don't know if anybody has that.
Yeah, I'll just share with you, there are lots of developments up and running right now, built all over in every city, and I don't think most people would ever know it from the standpoint of some units are sold under market rate. I don't think you could pick out those units from other units. You wouldn't know unless it came on the market and it said you had to meet a certain criteria income-wise to repurchase the unit. So if when it comes to paying market rate Does it look any different? Not in the resale world. I hope that answers the question. Thank you.
And then we have another question. How can the average non-landlord citizen get involved to help the homeless?
I can speak to an upcoming opportunity for engagement. Our annual point in time count will be happening this year in person, and all of our cities are seeking volunteers to participate in that. That is a wonderful, wonderful opportunity to meet our unhoused neighbors and to hear about the stories we're talking about, and also really provide a service to our community at large, because based on the data we're able to collect, that's a determinant for much of the funding that comes to our community to help end homelessness. So that is on February 23rd. And again, all the cities are conducting that point in time count. I know one place you can sign up is Volunteer Ventura County, but there are other avenues as well. And I'm sorry I didn't come prepared with other ways, but that is a place to start. And I'll open it to the rest if other ways to become engaged.
Anybody else? Okay, we have another question here. I wish we in Ventura County would start diverting our funding toward permanent solutions for homelessness. I think we could do more cheaper solutions to shelters, so we can spend more toward permanent housing. Cheaper options would be more River Haven options and safe sleep programs. I feel like it brings dignity to those who are unhoused. I would much prefer to keep reducing harm while we shift to our spending to a solution.
So I'll jump in on that, but before I do, I want to go back to your previous question, Assemblymember. Amy made a great suggestion, and then the count, volunteerventura.org, supporting community organizations that support these causes, like United Way, like Gold Coast Veterans Foundation. There's just, Lutheran Social Services. There's just an interface. There's an endless number of, not an endless, but there's a just great organizations out there that really appreciate either your time or your resources. So, and then on this question, yeah, absolutely. And I totally agree with the premise of the question that we need to focus our resources on housing. That's the end solution that we need, but we need all levels of the continuum here, because it won't work otherwise. For example, as I understand it from the experts that I work with, very rarely can you take somebody who's been homeless for a while and then just put them in permanent housing and it's going to work smoothly. That's just not the reality. Many folks have maybe health issues, mental health, drug and alcohol issues. So you need to get them in a shelter, get them stabilized first, and then you work with them to find the appropriate placement. So you need this entire continuum built out to have the whole system function effectively, because it's one thing to place somebody, but a really important measure is that they stay housed. You really haven't won the battle if you house them and they're there for a month and they leave, then you start all over again. So you want this to stick and to be sustainable.
I know that many city councils talk about workforce housing, but then they're very clear on they want it to be the workforce in their city. And of course, it's difficult constitutionally to just build housing for the people that are either homeless or lower income in the workforce. The question, and I understand that's what residents want to do, take care of their own. But the question is, if we were to really improve the homeless situation in Ventura County, wouldn't that just attract homeless people from near and distant places? And I was talking to somebody in Malibu, and they said, there's all these stories about people taking their homeless and putting them, in a taxi with $20 and saying, that city in San Diego can help you. What is the demographic generally of the homeless here, and are we seeing people move in?
The demographic is typically our own residents. I think there has been, I'd like to help dispel the myth around that individuals are getting, bussed in here, or that there isn't some local tie. A sense of community exists regardless of your housing status. So if you're unsheltered, there is a likelihood that your services are here, that the community, the family you've created for yourself is here. And we don't see that. We don't see that fix it and they will all start flocking. That has not been the experience.
I just want to just totally echo what Amy is saying, and we've heard that before, and so it's a really fair question. I really appreciate the person asking that question. But I had, and our team has had, a very similar experience. For example, with the Santa Clara River bed situation, we were asked, public safety, law enforcement, and our social health providers, no, they're local. We're not seeing almost any, knockwood, folks from LA coming up. And just as Amy said, most often we know who they are because they're connected to services. So we just want to continue the services and find them a place to live. We just aren't seeing that.
That just ironically, and I'm not an expert in any way, but Kay Wilson Bolton runs a very successful program in Santa Paula. And it's really interesting to see the stats, to have her conversation, her blog on a regular basis. And it's all local individuals, and that's within that small community. People are not going to that community. They're typically serving individuals from the community.
Yeah. Boy, Kay Wilson Bolton, what an amazing force of nature she is. That shelter and the work that she does out there, it just knocks you out. It's beautiful. I wanted to go back just real quick, if I may, Assemblymember, to your question about, stigma and concerns and so forth. And we talked about humanizing. And I think one of the things that's so helpful too is to, go out into the field, go with encourage elected folks to go, with their public safety folks or the social service, in coordination with them, and see for yourselves. And we've seen that with our supervisors Levere and Ramirez and Long and others, Parks and so forth, have gone out, into the field to see for themselves. And there's nothing like seeing and engaging with people in a respectful, dignified way to bring it home.
Hopefully, Mike, I think this would be your question. Can you comment on the legal issue of somebody sleeping in their vehicle? And are there any steps being made to make it easier for people to do that without accruing fines or losing their vehicle?
Yeah, it's such an important question, and one of the things we're working on collectively with our city partners and our county partners is to identify safe sleep areas. It's not ideal, but it's just one more level of stability, and so that will help. And it's something that we're actively working on right now, and we need to do even more.
And then we have a lot of. Oh, I'm sorry. Did you have something there, Matt? Oh, okay. We certainly have a lot of great partnerships in Ventura County, but where are there more opportunities for collaboration? Are there groups that you think that could be brought into the fold to really more holistically address the issues that we're facing in the county?
I would be repetitive and say including more with lived expertise. Perhaps helping encourage, making it easier for those individuals to attend meetings, or just have their voices heard, would be one place.
Mike, do you have anything to add, or are we doing?
Yeah, I agree with Amy on that. People with lived experience. I mean, who better? And it's so different too. It brings it home. It makes you think about more of what solutions are effective. You might read a paper about, oh, this is going to work. Oh, is it? Is that realistic? And so we have to be practical about it, and that really helps. But I guess what I would say is that, like being able to work with. There's so much good that's happening, and I want to, because a lot of folks might not realize that. They see the problem and they get it, and it's like, it's confounding. But at the same time, we want people to know behind the scenes that like the partnerships with the cities and the county and the community organizations and this continuum of care, where we have these regional discussions where everybody bands together and says, okay, collectively set aside our issues as a community. Where should this funding go? How should we solve this problem? We just need to keep building on that even more, I think. And now that we're getting these state resources, it's just perfect timing because we know where they need to go, where they're going to have the most impact.
I would just add, sorry, that many of us doing this work might feel that it would be helpful for greater collaboration among our housing authorities, and they're definitely taking some pretty bold steps in some of our various jurisdictions, but there are opportunities for greater collaboration there, I would say.
And if I could add one thing, I think, better engagement with landlords. I think it's a population that is absolutely needed in this process. The question is one of reach and connection. I think, the uniqueness about the landlord engagement program is that it really is hands-on. It's hands-on for both sides. And once there's a landlord that's involved, they really see the value in this. I think there's really a deeper engagement level that we need to uncover to reach more individuals that will go along with the cause that can really, really help. So thank you.
So it seems to me, and I think most people would see it the same way, there are a lot of different levels of homelessness, and some might be, the person that's, lost a job and is sleeping in their car. There's, people that are on the brink of homelessness. What many of us see, though, are the long-term homeless that are standing on the corner or camping in some area or in, next to the freeway here in kind of the unsafe situations. And because of the court case, it seems that there really isn't anything to do unless there's enough housing for all of them. In addition, many of them are not necessarily persuaded that they want to stop the lifestyle that they currently have. So presuming that we build enough housing or have enough shelter for those folks here in Ventura County, what do you think the steps are needed to get the long-term homeless off the street? I mean, how do we, when we are dealing with people with mental issues and potentially drug issues, how do we convince them to get into housing? Because those are the ones that really are, less likely to seek medical treatment. And when you're talking about lifespan that's 20 or 30 years less than the average person, I think that's really who we're talking about. So what are we going to do to deal with that population?
Yeah.
And I guess I'll just add, Mike, because I know that was a very long, complicated
question. I got it.
What does guardianship play, like changing the level that we can actually put them under guardianship?
Yeah, so I'll cut to the chase and then come back to the beginning. But at the end of the day, we need more housing, more affordable housing, more supportive housing. So that's. But again, we need that continuum fully built out. One of the challenges that we've had with COVID is that even our congregate shelters have had to limit capacity. So that's created an additional burden. So we're working on that as well. But the other thing that you talked about too was people with mental illness and drug and alcohol issues and medical issues. As I mentioned before, there's a lot going on right now with our whole person care, backpack medicine, community outreach of mental health and alcohol and drug services and medical. And that's really the way that you connect people and build that trust, to build their confidence to accept a placement. the skill that they have in building that I can't say enough about it. It takes time. It's not, one meeting, two meeting. It can take weeks or months. But then once they build that trust, then they can get a temporary placement. Then they wrap around more services, and then hopefully then they're able to be placed in that most appropriate level that's going to sustain for the longest time. And I think that's really continuing to build those community resources on the programs that we have. You mentioned mental health. Continue to build out the mental health continuum is huge, right? There's been a lot of efforts, inpatient unit, our board expanded the beds there, crisis stabilization chairs, we need more of those. A mental health rehabilitation center. We have one in our county, but we need more, and we're partnering right now with developers to build about 120 bed such facility, which we sorely need in our county. It's a top priority for our board, and it's moving forward out there at Lewis Road, and we want to keep that going. So again, coming at this from multiple ways, expanding our mental health crisis services. We're working on the board just approved that as well with our behavioral health department to expand those mobile crisis services. So just kind of being relentless and reinforcing of those successes that we're having, recognizing that we need more, but identifying those programs that are working and building on those.
And you nicely avoided the guardianship question.
Oh, sorry. Well,
and that is something that the governor mentioned. Yeah, it is something the governor mentioned that he wanted to work on this year. So I'm just curious from a local county perspective, what your thought is.
Yeah, I think it's a complex issue, and it's really important that we look at it. Done right, it makes a big difference with these very challenging situations for the individual and the family. So I'm pleased that we're looking at that.
Okay, I don't see, at least in my box, I don't see any more questions from the audience. So how about each of you finish up with any final thoughts and your call to action for either the local or state or federal levels, and why don't we start with Amy?
I would just impress upon our community the moral urgency around all of this, and of course, I'm probably stealing it from Matt, but call for more landlords to open doors for our voucher holders, and just to continue sharing stories and humanizing the situation we're facing, because this crisis impacts everyone and we all have a role to play, regardless of our employment around this or even our political beliefs around this. We're all a part of this.
Thank you.
Thank you.
Matt?
Thank you. I think Amy hit it right on the head. The thing that I'm pleased about is that we're having this conversation again. I think that's been said. And I think continuing this conversation is vitally important, because there is so much, as Mike has said, there's a lot of great work that's being done. I don't know that it's fully appreciated and acknowledged. I know from where I stand, I can do my part, but I learned a lot today about all of the things that are being done. I think continuing to work together. The thing that really resonates with me is we're not one of the larger counties. We can be much more nimble and do things that others can't do. And I think we've forged those relationships within our communities, with each other, with the providers, more so with landlords, with what needs to be done. And I think conversations like this really give me hope. And it should give all of us hope. That's what I'll leave you with. And a push one more time. We just need more landlords. That's all there is to it. More landlords. Thank you. And thank you again for facilitating.
Yes, thank you, Assembly Member. And I want to really recognize, appreciate Amy and Matt. I mean, this is what they're doing is so important. And you look at the 150 people. The problem's bigger than that. But if you get a couple of these and you keep expanding on this, pretty soon you're really, helping to solve this. You're already helping to solve this problem. And sometimes it might seem so big. It's like, oh, where do we start? But this is where we start. One person, 50, 150. And then there's another program that's addressing homeless folks who have a different type of challenge or need. That starts to, so just not being overwhelmed and staying positive that we have systems in place, and we have a super generous, compassionate community that wants to solve this problem with us, and we know which programs work. I think continuing to build on the shared collective that this is everyone's issue, cities, county, community, business, and we're seeing that, just continuing to build on that and assuring our state partners and leaders like you, Assembly Member, who, that when you get us the funding, which you've been doing amazingly, we're going to put it in the right places. And we want to show you how it's working and the results that we're having from it. And it's already happening. So just continuing to support this collective effort that we have and keep the momentum going. Thank you.
All right. Well, I want to thank our panelists that were on the earlier panel too, our speaker, United Way, and really all these groups in Ventura County. I think we are a unique county, and if anybody can figure out the right type of models to solve this issue, we can here in Ventura County, because there are so many great partnerships. The county government, the city governments are really working together to try to put a dent in this big issue. So I hope everybody learned something today, and we need to make sure that the conversation continues to go on. And have a great day. Thank you.
Thank you so much.
Thank you, Slimmer. Thanks, Matt and Amy.
Thank you.
Thank you, United Way.